I have worked for 40 years as a nurse. In all of those 40 years, have never once had the flu. I had it once at the age of 8. And I did receive the flu vaccine 2 years ago because I will tell you the honest truth, I needed extra money, our family needed extra money, and I did some flu clinics, and I felt so guilty that I felt that I needed to take the flu shot. 2 years ago, as you may know, they guess the vaccines in January and February of each year, and then they do that in Asia, and then they come to America and make these vaccines. And that year they happened to guess all 3 of them wrong. So I gave out hundreds of shots that had nothing in them that was going to help anyone, and I took one myself, and wasn't I just sick for the rest of the winter. I did not get the flu, as far as I know, but I actually missed some work, which I rarely do. I do work in the Saratoga area, and there are nurses there and other healthcare workers that I've spoken with who are also very much against this. From what I've heard, many of them feel that they cannot lose their income for their families, and at this point they feel up against a rock and a hard place. So I am just praying that today and in the near future we're going to reverse everything. I want you to know that the CDC itself has said that historically in America, only approximately 40%, and sometimes those numbers are different depending on which bulletin you're reading, of healthcare workers do receive the flu vaccine annually. And I just wonder why. Why do healthcare workers choose not to receive the flu vaccine? That's one I want you to think about. If this should pass, we are now going to be required to receive it yearly. Now, what do nurses do, actually? We take very good care of ourselves. We wash our hands at every corner. You will notice nurses have always got cracked red hands. That's almost a way to identify a nurse or a healthcare worker because we wash them so frequently. We wear masks. We will mask our patients if we feel that they have something that is communicable. We also can wear gloves, gowns, and we can use isolation if that becomes necessary. At the greeting desk where I work, we give viral packages, which includes a box of their own tissues. We teach them to cough in their tissue once and throw it away, masks, and a bag to throw their tissues in, actually. What can we as nurses do better? We can teach good hand washing techniques. We can teach people to cover their coughs. Take good care of your immune system. How do you do that? By resting, by eating well, increase your vitamin C and vitamin D, and in a minute I hope you've got papers and pencils available because I want to give you some websites to go to which will give you some more information on this. And by all means, if you think you're sick, stay home. Also, we here can contact the people that you've been hearing about today. That would be Dr. Richard Daines and Governor Patterson, and tell them about this outrage. The 2 places that I want to tell you to go to online, if you can, is nvic.org. Also, lifehealthchoices.com. And I just wanted to add one more thing. According to a Reuters survey on the 16th of this month, Harvard Dr. Mark Lipsitch said the H1N1 rating is on a number 1 of a pandemic scale of severity, 1 being the lowest, 5 being the most. He said that the death rate originally had appeared higher or worse because they had been tracking people who had died while in the hospital. And then they realized that they had not been tracking people who had the virus and who had never come to seek treatment. And those numbers went quite a bit down. And I thank you for this opportunity to speak to you today.